I'm Megan. It's a beautiful early morning here in Wisconsin, and I'm here to give you a practice that is for your knees. We will combine a little bit of somatic movement for mobility and for range of motion and also to wake up the muscles, with some yoga therapy to strengthen the muscles that support the knee. So if you're a person that's ever said, I have bad knees, first of all, please strike that from your record. You have healing knees. That's what I like to say, healing. We have healing body parts. But this practice would be lovely for you to do to keep your knees strong and pain-free. So you are going to need some props today. I have a strap here. You'll need some sort of a strap. You need a rolled blanket, or if you happen to have an extra yoga mat, that works too, but something about this size and round. And you will also need a chair and a mat, and I think that's it. And a dog, a lab dog preferably, named Bodhi. Okay, so we're going to start first with the somatics, which is the movement to create neuromuscular facilitation to wake up the muscles. And even though we're working with the knees, what we want to recognize is that as above, so below, or vice versa. When we have knee pain, we have to address, to me, the whole leg line, in fact, the pelvis too. Because if we've got knees that are stiff, that's going to affect your ankle, or vice versa. You might feel the pain in your knee, but it may be an ankle issue. So we're going to start all the way at our toes. So please take yourself down onto the ground, as Bodhi has. It's a good model for us. And relax onto your back. Invite yourself into your body. We'll take a moment just to ground and center. If you'd like a pillow under your head, you're welcome to do that, but we want to try to find the most neutral spine possible. And we're starting in constructive rest pose, which means the feet are on the floor, the knees are about as wide as the hips, and the ankles are right underneath the knees. So one of the ways to find your constructive rest is if you lift the leg up to 90 degrees, like as if you were sitting in a chair, then drop it down slowly. That's about the position you want. So this is a lovely place to begin because it helps us to ground if we focus on the feet touching the earth. So sense your feet. And then come back up into your chest and your torso and just feel your breath, your natural, spontaneous breath. You put in a request for your breath to guide you today. Allow your breath to be your diagnostic tool, so we know when we're pushing ourselves too much or trying too hard, because our breath will feel restrained. Restraint in the breath is usually an indication of restraint in the body. And before we start, take a moment then to look into your knees. Think of wrapping your mind's eye around your knees, and particularly if you have just one healing knee, visualize that knee and send it all of your love and your light and your support. Just taking a moment to honor your breath and your knees. And then we're going to start with the toes on the left foot. Sense the ball mount of the left foot, particularly behind the big toe and the little toe. And lift your toes away from the floor as you breathe in. And then just let them drop as you breathe out. And just notice the stretch through your foot. You might feel your calf muscle. If you want to do this to your breath, you can lift your toes, that's the effort on the inhale, and spread them. And exhale, just let them fall back down with gravity. Very simple movement for the toes. Spread them apart and lift them. And then relax your toes on the left foot. We'll come into the left ankle. So for this one, if you'd like to extend your left leg, you can. If there's any discomfort, then put something underneath the knee. So sometimes that creates a pulling in the knee or the thigh. Put something under it. And you're just going to inhale and reach the top of the foot forward. And exhale and let it go. So imagine pressing into that ball mound again. So this is our plantar flexion. The sole of the foot will tighten. The top of the ankle will open up. You might feel your calf tighten and then release. Notice how the shin stretches. Don't have to do it to the breath. In fact, you can hold it. But just feel the relationship between moving the ankle and the muscles in the foot and the lower leg. Might even start to feel your upper leg or some of the muscles around your knee itself. And I'm just reaching that forward and then releasing to that space of grace. So this is the mobility part, waking up the muscles. And then we're going to go the opposite direction. So feel the top of the foot. And now as you inhale, draw the top of the foot towards your shin. So this is a stretch for the back of the calf and the ankle. And then you're releasing. Notice how the front of the shin will tighten, the front of the ankle, the top of the foot. Just pulling that foot back. One of the things that helps me to pull the foot back and feel that stretch through the calf more is by pressing my heel forward. So you can imagine pressing your heel into a wall. Notice once again the relationship of foot and lower leg, but can you also feel anything happening with this movement right above the knee? Notice any muscles in the thigh as well. And then simply for more mobility, we're going to do what we call inversion and eversion, and I'm going to turn towards you so you can see that you're staying in the same position. You're going to take the big toe side of your foot. As you inhale, draw the big toe side of the foot towards your inner leg. So you're coming the arch of the foot towards your calf, and then release. That's your inversion. And then eversion is pinky toe side of the foot. Draw the pinky toe side of the foot towards your outer shin and release. So you're remaining relaxed on the earth, big toe side, although these can also be done seated. And then little toe side, and that relax in between. Inhaling big toe side, notice what you feel through your whole leg line. Release. Inhale little toe side. So start to see if you can feel some of those muscles in the inner and outer calf, but also anything going on in the thigh. So our feet are really important in waking up all the muscles that stabilize the knee. We say we have the majority of our proprioception is in our feet and ankles. So just these simple ankle movements helps to wake up everything in the leg line. Last one there for inversion and eversion. And then we're going to be going into the knee anyhow. So if you'd like to take that left leg, you can wrap your and your shoulders aren't lifting up. Otherwise, use a strap will be anyhow. And we'll just take the foot up just enough that you can see it and make nice full circles with the ankle. Let it roll around. Just exploring the full range of motion through your ankle. But also setting aside some of your awareness for feeling the muscles in the leg that are helping that ankle to move, the muscles in the foot. And if you've been going one direction, which you want to go one direction first, then switch. Purposefully switch and go the opposite direction. Checking in with your breath, your head's relaxed and whole spine and torso supported. Last ankle circle. And don't be surprised, these kinds of movements can sometimes create cramping. And that's okay. You got to work those cramps out, but it's just all that is your muscles I like to say your muscles are asking for oxygen because you're waking them up. So now we're going to go into the knee. So when we go into the knee joint itself, have the thigh bone straight up and down. So in other words, we don't want the thigh bone back here. think the thigh bone should be 90 degrees from the floor or from your spine, and let the low leg hang. I would like you to use the strap not behind the knee, but right in the belly of the hamstrings, so that nice strong part of the back of the thigh. As you inhale, you're going to go up and extend. And notice how I'm keeping my foot really, really relaxed. I'm not going to push through the heel. I'm not going to think of moving from my ankle. I'm going to move from my knee. So I'm imaging my thigh muscles lifting that leg up, so the thigh muscles will contract or shorten and the hamstrings will stretch. And then I'm going to slowly take it down. Feel the top of the thigh stretch and the back of the thigh engage slightly, although gravity is going to help you come down. So it's such a simple movement, but it's a great range of motion. And if you don't go into full extension, that's okay. If you want to feel a little bit more of the muscular engagement through the front of the thigh, as you're inhaling and coming up, press the thigh into the strap slightly, but keep your hands strong. So a little bit of forward motion of the leg. But keeping the foot relaxed, imagine that you're isolating this movement in the knee and initiating from the knee. If it feels good, instead of just moving through it, you can stop and hold the position for a few breaths. And then what I like to do is hold the position of the thigh, but once again move your toes. Now you can move your toes both ways. You can move your ankle. Play with keeping the leg line, the front of the leg line engaged, and move your foot and just see what you feel through the muscles of your leg, particularly those around your knee. And then we'll slowly let that come down. You can remove the strap. As I said, the leg, when we work with the knee, we got to look above and below, so we're going to go into the hip now. Very simple hip circles. You're going to lift up that left foot off the floor and think of relaxing your lower leg. So I'm not sticking out, I'm not moving from my lower leg, I'm moving from the circumference of my hip. Like I'm just making circles with the kneecap in the sky. And just finding that range of motion through the hip. Back and forth, so you can go out to the side, go away from the body, across the midline of the body, towards the body, and explore all those different directions and ranges of motion. If you've been going one direction, you can go the other way. These are all very simple joint freeing movements that I do just about every morning before I even get out of bed, before I step my feet onto the floor to wake up my legs. And then we're going to put that whole leg line together into some internal and external rotation. So feet will come back down onto the floor, but you're going to widen your feet to the edges of the mat. The external rotation, you would feel your pinky toe side of your foot and just let the leg come out. I like to do that on inhale, so I'm reaching my thigh bone outward. But also notice what it feels like for your ankle, because your ankle is going into that inversion. You're rolling onto the pinky toe side, drawing the top of the foot towards your shin. Notice what it feels like stretching your inner thigh, outer hip engaged, and then come back up. And then inhale and come onto your big toe side, reach that thigh bone forward and inward. Now you get a nice stretch in your outer hip, a little bit in the outer knee, and then coming back on exhale. So exhale is always that point of relaxing, releasing. Inhale, reach that thigh out to the side. Exhale, come back. Inhale, reach forward and inward. And just this nice back and forth motion, waking up the leg, and feel the whole leg moving together. We're going to add just a little bit more for this in a moment, a little more for the knee mobility and to wake up the muscles. But we want to find this internal and external rotation. So then you're going to bring that leg back up. At this point, if you want to keep the right foot on the floor, you can. If you're comfortable and you want to extend that right leg, You can do that, and you can do it with a bolster or something underneath it or blanket under it. So now we're going to kind of do that internal external rotation, but take it a little bit further. So you're going to lengthen out the left leg, and then you're going to draw the heel towards your buttocks, let the knee come out to the side. So there's the external rotation, but the foot's on the floor and I'm sliding it on my mat. If you've got a real sticky mat, you may need to fold it. Then I'm going to lengthen that leg out again. Now I'm going to come into the internal rotation, so I'm turning my thigh bone in, my toes coming in, my big toe, and I'm going to slide my heel to the outside of my hip. So there's the internal rotation. Don't force any of these movements. And then long again. The other thing is, obviously, if anything is contraindicated, if there's pain in your knee with either of these movements, then you would not do these. Or you might be able to do them, but just do half of what you're able to do, right? Some mobility is better than no mobility. So not pushing yourself, just waking up that leg. So your extension, and then you roll the thigh bone outward and draw the heel towards your buttocks. Extension, roll the thigh bone inward, draw the heel towards your outer hip. Pausing anywhere along the way that you'd like to. Feel how that whole leg line is moving. Ankle, knee, and hip, all the joints working together in harmony. I really like this one. I just like to imagine that my leg is in water, maybe a nice warm spa, and it's just a swimming leg. The opportunity to stop anywhere you need to, just let the leg hang out. Take a few more. And then we'll extend that left leg long. If it's comfortable, you can extend your right leg long too. And I just want you to take a moment to be completely still in your body and feel the space from your left toes to your left hip and your right toes to your right hip. And think of the knee right in the middle there. And can you sense any difference in the two sides of your body, your two legs? The muscles, the joints. Any words that come to mind, there's no right or wrong. A heaviness or lightness are common. Warmth or coolness, or might even be fatigue. So we don't judge the words that come to mind. It's just this opportunity to be present in sensation and your sense, your inner world. And say thank you to your left knee in particular, but your whole left leg line from the toes up to the hip. And then before the right leg gets too jealous, we'll do the right leg. So you can slide both legs back in, feet to the floor. Finding constructive rest, feet are on the floor. Allowing the low back to be long, shoulder blades relaxed. Find a good position for your head and neck. And we'll be doing the right leg. So we start with just feeling our right toes. And maybe the ball of the foot. Feel the big toe side of the ball of the foot, little toe side. I'm going to turn towards you just for a moment. So remembering you're going to keep the sole of the foot, the ball mount of the foot on the ground, and as you breathe in, just lift the toes up off the floor and then take them back down. And you can see how simple this is and that it can be done seated. But rather than watching the toes, especially if you're seated, you can't see them if your feet are on the floor and you're lying down, but don't watch, but feel. Lift the toes, feel the arch of the foot as it activates, and then take them back down. Spread the toes. And as you're doing that, you're slightly pressing the ball of the foot and the pinky toe side of the foot, big toe, little toe side into the ground, and then letting them go. And just feel that relationship to the ankle, maybe muscles in the shin and the calf, and perhaps even all the way to the knee. Just the right toes. Now we're going to go into the right ankle. So take that right leg out long. If you'd like to roll up a blanket and put it, you already have your blanket rolled, so you can put it right underneath your knee. So inhale, reach the top of the foot away from your shin. So press through the ball of the foot, the ball mound of the foot, big toe, little toe side. And then exhale, just release it. So moving that ankle into plantar flexion, the sole of the foot will tighten, the top of the foot will stretch. And then release, just release. Also notice how your calf will tighten, your shin will stretch, and release. You might even feel something in the back of the upper leg line. So notice the muscles on either side of the knee, above and below, but moving from your ankle. I like to imagine the energy of the ankle moving is that energy goes all the way up the leg, sending that signal to activate the muscles in the back of the leg as I draw the top of the foot forward. And then letting go, we'll do the opposite. Feel the top of the foot. And as you breathe in, draw the top of the foot towards your shin, press your heel away from you, and let go. So if you have tighter hamstrings, tighter calf muscles, you're really going to feel this one. Hamstrings perhaps, but definitely calf, because we're stretching the calf. But notice the muscles in the front of the shin engaging and then releasing. I was out on a paddleboard yesterday, and sometimes my feet get a little bit crampy and my calf muscles get tight. So this feels good after that. And you're just actively drawing the top of the foot towards your shin. If you're doing it to your breath on inhale, then release to your natural state of grace on exhale. Notice now that front leg line, can you feel some activation in the muscles just above your kneecap too? Right, just by moving our ankle. And relax. Then we're going to do the inversion and eversion of the ankle. So I turn towards you again. Sense the big toe side of your foot, the arch of your foot. And as you breathe in, draw the arch of your foot towards the calf muscle, that inner calf. And let it relax. Feel the pinky toe side of your foot. As you inhale, bring the pinky toe side of your foot towards your outer shin. Let it relax. So inversion and release and eversion. And release. Seems really simple, but this is one of the range of motions I find a lot of people are limited in, and it's just a matter of waking up the muscles. So rolling inward and releasing and opposite. Or think of drawing the arch of your foot towards your inner thigh line and releasing. Pinky toe side of your foot towards your outer hip and releasing. Notice all the muscles that respond in the leg line. And relax that. All right, we'll find our full range of motion through that right ankle. So of course you could leave your leg where it is and just roll it around. I do like to lift it up at this point, placing the strap around the back of the thigh so your arms and shoulders can stay relaxed. If you want to extend your left leg long, you can. I'll do that so you can see a little better. And maybe you just want to take it up slightly or can stay down here, but making full circles with that ankle. Going nice and slow. Take your time. Go one direction. If it helps you, imagine you're drawing a smiley face, right? To find that full circle. And then you can go the other direction. And it'll feel different too if you initiate. You can initiate from the heel or feel yourself from the heel. You can feel yourself from the arch of the foot, the ball mount of the foot, sensing your foot from different places. And then let your ankle go. Thank you, right ankle. Always an opportunity for gratitude for our body parts. Now as we go into the knee, it's important that if the thigh was pulled back, you want to take that thigh bone forward so that the front or the kneecap is right over the front of the hip. So thigh bone is 90 degrees from the floor, from your spine. Let the lower leg hang and dangle. Relax the ankle and the toes. Be sturdy with that strap though, and the strap is on the belly right in the center of the hamstrings. You're going to inhale, think of lifting your lower leg from your knee. So I'm not going to push through my heel. I want to use my upper, encourage the movement through the upper thigh muscles. So you're going into extension and then slow release, not just dropping it down, but kind of falling in gravity with a little bit of resistance. And just play with that. If you don't want to do it to your breath, you don't have to. Anytime we don't do breath center practice, that's all good, but just checking to see that your breath is not strained or restricted in any way. And working within your full range of motion. Feel the mobility of your knee. Even if it's limited, you know, one side might be quite different than the other. But see if you can retrain your brain to say this is, instead of saying this is my bad knee, this is my healing knee, or even grumpy. I like to say this is my grumpy knee, which is actually my other one for me. And an extension and release. And notice the relationship between the lower leg and upper leg, particularly though, can you feel the muscles of the thigh beginning to fire? Because those are some of the muscles, the top of the thigh, that we're going to engage and strengthen. Doing one or two more. And then let that go. You can let your foot come down. We'll be doing the right hip. So think of the hip circumference of the hip crease. Relax the lower leg and the ankle and the knee now. And range of motion through that hip. As I mentioned earlier, these are really simple movements to do in bed before you, right? This is some bed yoga here. And if you have one side that is your grumpy side, you can always take more time on that side. It needs more attention, right? Give it more attention. You can switch and go the opposite direction with those hip circles. And then relax that leg down. So we're going to do our internal and external rotation. So your right foot's back on the floor. Sense the big toe and little toe side. As you inhale, fall onto the little toe side, so your thigh bone will fall outward. I could turn towards the camera. It's falling outward on inhale. And then coming back up. And thigh bones falling inward. And I forgot to mention, if your legs crashing, then make your feet wider to the edges of the mat when you do this one. But you're just rolling through your ankles, so there's that inversion and eversion, but also the hip, the whole leg line going from right to left. And you can play with doing the movement from your foot versus doing the movement from your hip. It might feel a little bit different. And one or two more. And then we'll do our final movement of that whole leg line. So this is the one where we'll be sliding the foot. I'm going to turn towards you again so you can see. And then blankets right here. You're going to slide that right leg long. And then you're going to bring the heel up towards your buttocks, dropping the knee open. So you can do it to your breath, but it gets complicated. Just make sure you're breathing, sliding it out, letting it fall. Sliding it along again, letting it go. So always find that space of grace where you're relaxed. And then you're going to roll the thigh bone in, foot comes in, slide it out to the outer hip, maybe let it fall, slide it long again, let it go. So do this at your pace. Externally rotate the thigh, so roll it away from the center of the body, draw your heel up towards your perineum, slide it long, let it go. Then internally rotate the thigh. So feel the muscles that do that rotation, right? And then those muscles are also going to help you to bring that heel up towards your buttocks. Take it out, let it go. So you can actually engage the muscles before you slide the leg by rolling the thigh and then bring the heel up. Maybe let it drop and relax. Feel that stretch. Take it long, let it go. Just do a few more of these. Anywhere you want to stop and hold, you can do that too. All right. And then come back to the center, take both legs long. We'll take a brief moment again just to release and relax and feel. Be feeling beings instead of doing beings. Feel your legs, both legs from the toes to the hips, and just say thank you. Thank you to your knees. As we get ready to go into our section on strengthening and stabilizing the muscles that support the knee. So we're going to roll over first while we're down here, and we're going to do our hamstrings. So you're going to roll onto your front side. Unclip my mic. And take a moment to find where your upper body is as cushy and comfortable as possible. So you might rock your legs side to side, shift your hips, jelly roll your legs, and then also take your head. If you want a pillow, use a pillow. You can use your arms as a pillow. I have to position myself so that you can still hear me. And then we're going to start with the left leg first. We did that on the other side. So actually I may turn the other way. You're going to bend your left knee to 90 degrees. There you go, dude. So you're going to put into that position. Heel right over the back of the knee. Sometimes this is hard to see, so if you have somebody else handy, just let them line it up for you so you know. And just push the top of the to the earth. And notice how you feel some engagement through the back of the thigh and the glutes. So your hamstrings and your glutes. And then let that drop out, relax it. Just doing a few of these. 30 to 90 degrees. Push the thigh into the ground. And also, one of the things you want to watch is when we push the thigh in, the hip doesn't pop up the thigh and keep the hip on the ground. Sometimes what's helpful is to keep your left hand right underneath that hip crease. So when I'm completely relaxed, I can notice where my hip is touching the earth, and I want to keep that connection. Bending, pushing down, feel that engagement, and then let go. And depending on how your hamstrings relax or react, so if they're getting crampy already, you may want to just do this one, bend the knee, press the top of the thigh down, just to feel that engagement through the hamstrings and the glutes, and then let it go. But otherwise, we're going to take it to the next step. So you're going to push it down to initially engage. Now you're going to lift the thigh up. But notice I'm keeping my hand underneath the hip, because what I don't want to do is lift my hip up. I'm not lifting my hip up, so this would be an external rotation of that thigh. So what can help us not to externally rotate it is drop the foot out to the left side a little bit, so that's actually internally rotating the thigh, and then lift. So that's hamstrings and glutes, lifting it up, drop it down, and let it go. And this one, because we're not working so much on mobility, we did the mobility, is also, by the way, a great way not only to strengthen the hamstrings, but to release them. So a lot of people that say their hamstrings are tight, they're actually tight and weak. So it addresses both of those things. What you can do is, within your own scope, push your heel into the sky, lift it up, and hold for a few breaths. Watch that you're not holding your breath. Also watch that this hip isn't lifting up. So press the front of the left hip. That's how we begin to build strength, is you can increase your hold time and feel those hamstrings and glutes. Still breathing comfortably. And then release down and make sure we completely release. Shake it out. So you might feel a little bit of a butt burn. That's okay. Butt burning is totally normal. Bend the knee. Push the thigh down to initially engage the back of the leg line, the buttocks, and then dropping the foot out to the side just a little bit, or making sure we're not internally rotating. Lift that leg up. Push the heel up towards the sky. Breathe. And see if you can keep the right side relaxed. Engaging through the back of the left leg line. And you're stretching the top of the left thigh. Notice the space around the kneecap. Taking a few breaths. Your hold time. You may do 2 here. And then slowly releasing down. Shake it out. Let it go. All right. We're going to switch sides. So I'll turn towards you again. Feel free to shake that leg out a little bit more, both legs. Right leg. Cue the right leg. Bend the knee. Place the heel right over the back of the knee. And initially just push the top of the thigh into the ground, but watch that the hip crease doesn't pop up. I've got my mic thing there, but keep that hip crease flush to the earth wherever it started. And then release the leg back down. You can shake it out a little bit. Bend the knee again, push the thigh, so watch the hip doesn't pop up. Push the hip, front of the hip into the ground and the thigh. Imagine reaching your kneecap towards the back of your mat. That'll help to lengthen the thigh and keep that hip crease on the floor. So reaching kneecap back and then letting it go. So if you got cramps in your hamstrings, start with just this one, because this is engaging and strengthening the back of your thigh and your glutes. Feeling that, right? You can feel that tightening of the muscles. And then notice the release of the muscles. But also remember, the cramping is just your body's way of asking for oxygen. And we'll do that again. This time we're going to take it into the lift. So you're going to press the top of the thigh into the ground. Press the heel up towards the sky. So we're already engaged, and then you're going to lift up. And don't be surprised if one is a lot stronger than the other. Most of us have that. Watch that your knee doesn't start to take its own little ride out to the side, or that you're not dropping your foot in. So that's that hip lifting up. So you want to lift straight up. Another cue that helps me is to lift the inner thigh, not the outer hip, but the inner thigh. Take it down, let it go, relax, shift your hips side to side. So you're doing this in your own time. You might do a few movement or shorter holds. I'm going to do 3 with you. So that was the first one. Press the top of the thigh into the earth. Then lift straight up. Think of inner thigh lifting. You might even drop your right foot out to the right side just a little bit to keep that leg from externally rotating. See if you can relax the left side. Feel how strong your right leg is. And particularly if you know that you have just one grumpy knee. So if one of your knees is grumpy, what I would do is work on this pose a little bit longer on that side, right? Because you want to really work on strengthening and stabilizing that knee. Let's do one more. Bending the leg to 90 degrees. Press the top of the thigh into the ground, but lengthen the knee towards the back so the hip crease stays on the ground, and then lift it up. Sometimes we call this one the Buns of Steel pose. Oops, I don't think I'm lined up though. Lifting up and pressing up. You can hold as long as you'd like, or for as short as you'd like. And then drop that down. Let it go. Relax. Shake it out. All right. If you need to stretch your back out, you can press yourself back into a child's pose. You could also come up and do a few of these lovely cat cows, because when we're working the legs, you want to make sure that the spine is still happy with you, with your decisions. So you might do a couple of those if that's in your wheelhouse. See where you need to go in between. And then we are going to be pulling in our blankets, and you need a wall, a chair, something to push your foot into that will not move. So I'm able to use a block at the wall. I'm going to pretend this is a wall, but I have to use a block. And the blanket. So this is about engaging a particular muscle. One, the vagus is of your quadricep muscles, so top of the thigh, but very important in knee stability. They all are. There's 4 of them, right? But this one is particular to that muscle. So you're going to take your rolled blanket, and you're going to put the rolled blanket, I'll show you from here first, put the rolled blanket underneath the back of the knee, and then the foot is going to come into the wall, so you wouldn't have to have a block. I have one just because I'm using a railing out here because it's beautiful out here. And so the blanket is there underneath my knee. I can keep my right leg bent. I'm doing my left leg first. And first just experience the idea of pushing your heel into the block, and as you put, or into the wall, sorry, you're using a wall, push your heel down and then push the back of the knee into the blanket. And can you feel these muscles firing in the top of the thigh? Particularly the VM comes across the thigh and into the knee. It helps to stabilize the knee, the inner knee, and then release that. So this is another one. You can do it in movement, but what we really want to do is look at building strength in that knee. So you're going to push the heel and the ball mount into the wall, push the back of the knee into the blanket, and see if you can hold that. The other thing that helps for me is to imagine drawing my kneecap up my thigh towards my hip. So your kneecap will lift, and you'll feel, if you touch, like investigatively touch that left thigh, it should feel solid and strong, right? Breathing and holding, and just feeling that sense of strength through the top of the thigh. And then let it go. We'll do 3 of these too. Although once again, if one knee is more in need of strengthening, you can do more on that side. So I'm pushing my foot into the block, pushing the back of the thigh, or back of the knee specifically, into the floor. Lengthen your leg. And the other thing is we want to watch, I'm turning towards you, so please forgive me, but if I were up where I need to be, I would be supporting myself so I'm not rounding through my spine. I want to keep my spine tall, use my hands. So it'd be like this. But it's really that action. Say I don't have that pushing of the foot now. That action of pushing of the foot is what really will take you deep into those thigh muscles. And take this last one and hold for a few breaths. Feel all those muscles contract on the top of the thigh. And it's almost like it's framing out your knee, right? Allowing that support, offering support to your knee. Hold it for as long as you can comfortably, and then let it go. Shake it out. So we did the back of the thigh, the hamstrings, and then this was the top of the thigh, the front of the thigh. Shaking out. Once you know these are simple things that you can follow my video. You can also do them on their own without the mobility part first. Once you know them, you can do them for as long or short as you want, maybe just 1 or 2 of these exercises at a time. So we'll do the right leg now. So right foot's going to push into a wall, something that's stable. Your left leg is bent and relaxed. So we say we have 4 corners in the feet. You're going to push the big toe mound, the little toe mound, and the 2 bottoms of the heel. So if we had 4 corners, push all of that into the wall. So that's going to activate that leg line, and then push the back of the knee into the blanket. Imagine drawing your kneecap up your thigh and your thigh bone into your hip even. So when I draw the thigh bone into the hip, that lifts me up and I come forward onto my sit bones, and I feel really strong through that thigh. You can hold for a few breaths. See how long you can hold it. Feel the stabilizing force in that upper thigh, and then release. And then doing that again. So this one is really good. I had what we call the meniscus. You have the lateral inside and medial, or I'm sorry, lateral outside, medial inside. So if you have a meniscus tear, this is a really good pose to help to strengthen those knees. We'll do a second one. If you didn't release it yet, go ahead, release. And then push that foot into the wall. Draw the back of the knee into the blanket. Lift up onto your sit bones. Feel that whole leg engaged. You also feel your calf and your shin. But really focus on this upper thigh. Might even get a little trembly. Sorry, I have my back to you. And then let that go. Relax. All right. We're going to be doing a few more for that vastus medialis and for our quadriceps in general, because I find knee stability. So you're going to want that block. And we're going to do our chair version first. So I'm going to sneak off camera, grab a chair. Chair version. Okay. So basically what we just did can be done, and this is what I love because I get comments all the time from people that, oh, you know, I sit in a chair all the time, my body gets so cranky. These can be done in a chair. In fact, they're meant to be done in a chair. But what's important when we sit in a chair and do these is that we're not actually sitting in the chair. This is sitting in the chair. This is doing yoga in a chair. So sit up tall, hold yourself up with your spine, right? Stack your ears over your shoulders and your shoulders over your hips and draw your diaphragm in the center. Your diaphragm is your creamy center. And then start with your heels right underneath the knees. So we don't want the feet like this or back here, one back here. Both heels right underneath your knees. So you feel aligned. There's some symmetry in the body. And we'll do the left leg again first. So this one, you're going to press the back of the thigh into your chair and then lift. There we go. So a little juicier, a little more weight bearing, but same muscles. Feel the ripple. Those are those big rippling muscles in your thigh, right? But feel those engage. And you can hold it there for as long as you'd like. Remember when we were pushing, or let it go. I'll let it go for a moment. Remember when we were just pushing the foot into the wall. You want to have that same sensation. So you got your chair, you're going to lift that leg up, but imagine pushing the 4/4 of the foot forward, draw the kneecap up your thigh. It's all still there. It's just going to be a little bit more intense because you got more weight bearing. And I'm not lifting the whole leg off the chair. In fact, I'm using the chair to press the back of the thigh into. Just breathe. Feel how strong those leg muscles are. This is another one that you could do, you know, it doesn't have to be, our bodies are not symmetrical actually. We try to make them symmetrical, but if you've got pain in one knee, you can do just that knee. And then let it go. Maybe shake it out a little bit. We'll do a third one with that. Watch that you're not falling back in your spine. Stay up tall. That might even mean holding the sides of your chair, depending on what kind of chair you have. Press through the heel and the ball of the foot. So my toes aren't reaching. I'm actually more in what we call flaunting your foot, or Barbie doll toes. I'm pushing the ball and the heel forward, but pulling the toes back. And then kneecap comes up the thigh. Breathing into that thigh. Suck that kneecap up. Feel how strong your thigh is supporting your knee. Smile. And let it drop down. You can shake it out. Watch it. We are not. Come forward, rock forward onto the front of the sit bones again if you need to. You can even hold your chair. And then we'll do the opposite leg. So you're going to lift up that leg. And you may not be in full extension. You might be down here, right? Because that was range of motion. If when we were laying on our back we weren't going into a full extension, then you're not now either. And that's okay. You're still strengthening. So you might be somewhere down here. But even if you're down here, press through the heel and the ball of the foot. Draw your kneecap up your thigh. Press the back of the thigh into the chair. And feel yourself lift up. So remember what it felt like when we had the foot on the wall. That imaginary wall is still there for the foot. Building those strength through the top of the thigh. Smells like I'm about to get rained on. and let that go. So you may be doing shorter holds, it's really up to you. But I'm showing you this one too because like I said, if you sit in a chair all day and you've got grumpy knees, it's better to get up and walk too. But here you go, right? Just build some strength holding that leg up. Anytime we work with gravity, that's enough to engage those muscles. Pressing the back of the thigh in to the chair, reaching through the heel, drawing the kneecap up, ball the foot forward, heel forward, toes back a little bit. I like to even imagine the inner arch of the foot drawing towards my buttocks. So that really engages that inner line, and then the pinky toe side drawing towards my outer hip, engaging that outer line of the leg. And take it down. All right, so those are our leg sit strengtheners. I'm moving my chair out of the way. You can do the same. You're going to need that wall again, so I'm going to pretend this is a wall for you. And you'll also need a block. So this next one is a chair sit. So what's really important when we do the chair sit is we don't want to have the knees way in front of the toes. The knees, if your knees are grumpy, this is not where they want to go. So that means we need to start with our feet a little bit more forward. So you're going to take your back to the wall. Pretend this is a wall. I can make this work. But you're going to take your whole back and spine to the wall and then walk your feet forward so that your ankles are underneath your knees, not your toes. So to walk your feet all the way forward with a bend in the knees, and your shin bones are straight up and down. You're going to take the block, and you're going to put the block between the thighs. So this way we're getting into the inner thigh muscles as well. So you're going to squeeze that block with the inner knees, hug it in, and notice how much more strength you have. And we can just do that. Squeeze the block and release just a few times. And so these are your adductor muscles, all those inner thigh muscles. You might feel it all the way up to the sit bones, but also feel it on the edge of the knees. And by the way, I don't have the block between my knees. I say between my knees, that was not accurate. It's actually just above the knee joints. So not on the knee joints, but just above really feels better, where you can feel the muscle, not the bone, squeezing that block. And then if I had a whole wall here, I'm going to slowly begin to sit down. If at any point your knee joints are not comfortable, you stop. But my knees are pretty much staying behind my toes. They are staying behind my toes. You're going to do a wall slide. You're going to slide down the wall, and you can hold. And now you're going to feel all of those muscles wrapping around the thighs. So inner thighs engaged because you're squeezing the block. You're going to feel the tops of the thighs, those hamstrings we woke up. If you want to feel more in the outer hips, you can take your hands to your outer hips and gently push your hips or outer thighs into your hands even as you're squeezing the block. So it's a crazy idea that you're squeezing inward with the inner thighs and pressing outward with the outer thighs. Sit as long as you can and then slowly slide up. You can even take the block out in between if you want. Simple wall sits, but I find the block is really important. The other thing to look at when you're doing the block is that I didn't show that this has different sizes. So you want to try to keep your tracking so it's comfortable. So the center of your hip crease should come through the center of your knees. Center your knees to your middle toes. So in other words, I don't want to be way out here necessarily. And if I don't have the block, my knees might fall into the edge. So I like the block. If you have a ball too, by the way, a ball would work. But you can play with, I could do a little bit narrower stance. So walk your feet forward. You're using the wall also to stabilize you so you're balanced. Squeeze that block. I noticed I have a harder time engaging my thighs though when I'm narrower like this. You can press into your heels too, and you'll feel your glute muscles, so the backs of your buttocks and your hamstrings, and then slowly sit down. But not letting, if my feet are too close to the wall, my knees are going to go way in front of my toes, and I don't want that. So I started with my feet about a foot from the wall, probably more like a foot and a half, and then I slide down. And I'm just going to hold. I only laugh because we used to do these in high school basketball, our wall sits. No block though. I actually find the block makes it sturdier. So I go back to my basketball days. Squeezing and feel. So these are some really big muscles. Super big. They're going to want lots of oxygen. So if you find yourself hyperventilating, come out. Otherwise, breathe a little bit deeper. Give them that oxygen that they want. Remember to press into the ball mount in the heels. The heels are going to help. If you can push your heels into the earth, you're going to feel that back line of your legs more. More we squeeze the block, you're going to feel the inner line. More you press your thighs out, you'll feel the outer line. And then draw. Imagine. So the other thing we can do is we can get our psoas active and the hip flexors more. Take the hands to the tops of the thighs and imagine lifting your thighs into your hands. So these are all just little things. And then I can really feel the tops of the thighs engage. Or draw those kneecaps up again. You're holding that wall sit, keeping your shoulders and head out the wall. As long as you want to go, you can come out and then walk back in slowly. So again, if that upsets your knee pain, then if it's in the joints, I wouldn't do it, but recognize the difference between having knee pain in your joints versus feeling muscles in your legs. You know, we might wake up some muscles. We're gonna do something similar to that, down onto the ground. Feel free to shake it out first. You can do some windshield wipers. Final strengthening pose, very similar to what we just did. But this one is a little bit more specific for the inner thighs and outer hips. So you're going to take that same block, put it between the knees, coming back into constructive rest. So heels are underneath the knees. Squeeze that block, press your heels into the earth, press the balls of the feet in the earth. So one of the things I see a lot is when people do bridge pose, their feet lift. You need to engage your leg line from your feet, so press into your feet first, and then lift up, squeezing that block. And this is where we stay. As long as you can. Squeeze inward, so you're going to get your hamstrings and your glutes. All of these are really important in supporting the knee joints. You might even feel your calf muscles. Inner thighs, squeezing that block. And breathe there. And even if you're just barely lifted, but remember not to lift the toes off the floor, push the feet into the floor, and imagine even dragging your heels towards your buttocks. Notice the space in the tops of the knees. Last breath, come down, release. You can even take that block out for a moment, rock your legs side to side. You can vary the distance between the block, but either way with the block between the thighs, we're really focusing on those inner thigh muscles lighting up, and that tends to be weak too, really important. So squeeze the block, feel those inner thighs, press the balls and the heels into the floor, and then inhale, we'll do one more round, lifting up, or maybe you're doing 3 rounds, right? You're holding at whatever comfort is there for you today. Challenge yourself, because this is the strengthening part. One of the ways we know that maybe we're getting ahead of ourselves doing too much is you'll start, if you're usually able to breathe through your nose through the rest of this practice, you'll start to, breathe through your mouth. So that's a sign you might be doing too much. You should be able to still breathe through your nose. A calm, fluid breath. But press and feel how strong those muscles are. And let yourself come down. From there, feel free to just windshield wiper the legs. You can draw them into your body, move them around. You're setting yourself up for a quiet position for Shavasana, wherever that might be for you today. A quiet Shavasana finish for you. I'm going to finish because we have a lovely storm coming right now, about to get rained on. Enjoy your day. Thank you. Bless your knees. Thank your knees for all of the places they take you. In the whole body, we say our knees are our buffers for reality. So that leaves you something to think about in your Shavasana. Buffers for reality. Peace, joy, love, and light. Namaste.